The month of October, we have been having some very important conversations to mark Breast Cancer Awareness Month. On this final day of the month, we are focusing on a common and often challenging side effect that can often occur after breast cancer treatment. It's called arm lymphedema. This condition can cause swelling, discomfort, and difficulties with everyday activities. Joining us today to share her expertise is Dr. Danielle Heller, breast surgical oncologist at the Hartford Healthcare Cancer Institute. Dr. Heller, thank you so much for being with us this Friday morning. Can you explain what arm lymphedema is and which patients are really at highest risk?
Sure. So arm lymphedema is progressive arm swelling that can happen as a result of damage to the lymph nodes under the arm and the lymphatic system. Um, our bodies naturally make lymphatic fluid as a result of cell metabolism. Normally, that fluid will travel through the arm and go back into the circulation. But during some breast cancer surgery, we have to take out lymph nodes and cut some of those lymphatic channels. So that fluid can back up into the arm and cause really debilitating arm swelling.
Doctor, which key strategies do you recommend to lower the risk of lymphedema after breast cancer treatment?
So we normally think about the strategies as either non-invasive or invasive, right? So on the non-invasive side, our patients normally work with physical therapists who are specialized in lymphedema therapy. They teach patients arm exercises that can lower their risk. They give them the do's and don'ts during the recovery after surgery, and can really help lower the risk and really prevent lymphedema. And then on the invasive side, we're actually offering procedures now that can aim to really restore that circuit between the lymphatic system and the normal circulation. And we do these procedures like a procedure called lymphovenous bypass, which your viewers may have heard of, at the same time as the breast cancer operation.
Yeah, I was going to ask you about the lymphovenous bypass that you mentioned right there. How does it work and who should really consider choosing that option?
Lymphovenous bypass is a procedure that the breast surgeon and a plastic surgeon do as a team. The way it works is that during the lymph node removal, the breast cancer surgeon tries to preserve some of the large lymphatic channels that drain the arm, and also some of the deep veins that are inside the underarm. And then when the breast surgeon is done, the plastic surgeon comes in and actually rebuilds a connection between that lymphatic channel and that deep vein. Sometimes the plastic surgeon needs to take a vein graft from another part of the body, like the leg or the arm. But the whole idea is to really restore that circuit so that that lymphatic fluid can actually travel through that new connection and drain back into the bloodstream.
And doctor, finally, can you describe what breast specialists at Hartford Healthcare are doing to lower the risk of lymphedema and improve patient outcomes?
Yeah, so we have a really wonderful comprehensive lymphedema program at Hartford Healthcare. From even before surgery, when patients are diagnosed, if they're at risk of getting lymphedema, if they need lymph node surgery, they're plugged into this program. And what we offer is a combination of screening for lymphedema and also plugging patients in really early with our lymphedema specialized physical therapists. So patients will be screened for lymphedema before surgery and then at regular intervals after surgery. We check them very closely for any symptoms they might have, and then we plug them in. And then, of course, our highest risk patients, we also offer this lymphedema bypass surgery during their same breast cancer operation.
Dr. Heller, thank you so much. Thank you for your time this Friday morning.
Thank you so much for having me.
We appreciate you.